that brings us to your weekly capsule of health information. We call it Your Healthy Dose. And we are joined once again by a familiar guest, Mr. Tim Polly, Executive Director of the Hannibal Regional Medical Group. Tim, good to see you.
Good morning. Always good to be here.
And welcome to our studio once again. You've got a lot of things going on, but basically we want to focus more on bone health, keeping our bones healthy, drinking milk every day, eating the right things, exercising, etc.
All that fun stuff.
Oh, yeah.
I mean, I've talked about orthopedics a lot in the past few years since I got here, but today I wanted to kind of come over and share with you a couple things. One, we recently found out that, don't know if you guys are familiar with, the community's familiar with a group called Health Grades, but it's an organization that measures hospitals on different things and gives them awards or grade or stars or something of that nature. And our orthopedic program received something called one of the top hospitals in orthopedics. And it's always a year behind, but we got it for 2012. And we're really proud of the fact that our hospital does such a good job in ortho. But not only that, there's a large Adams County, Illinois group, or population that comes over to see us primarily for ortho. So we're really happy about that, really thrilled about it.
Congratulations. Yeah,
thank you.
Talked about that last week and some of the various aspects. And there are a number of orthopedic services that are offered, a lot of specialists that focus on certain areas of the body that can help you get better.
Well, there is, and that's kind of the exciting part about it is when we first built the Bone and Joint Center, which is a program that's focused purely on your hip and knees. We all know that the baby boomer population has increased. We're not only getting larger in numbers, we're getting larger in size, and we're not exercising as much, so that puts a lot of pressure on our hips, our knees, and our backs. So in the last 7 or 8 months or so, we always had a hip and knee specialist with Dr. Bauman and Dr. Burton and Dr. Bienick, but Dr. Basho came all the way from L.A., from University, UCLA out there, is a new spine guy. And we were able to get him to to Hannibal to focus on spine.
Well, that's quite a draw.
It is, and it was funny because I helped in the recruiting process, and I think he's going to get me at some point. But he's a good guy. Not only just a good surgeon, but he brings capabilities to our region that didn't exist a while back.
Phenomenal.
All right. Yeah, I think you referred to that more as a tap instead of a draw, right?
Oh, wow.
Hey, as we talk about orthopedic services and bone and joint and all that, how does this benefit the folks of the TriState?
Well, it does because typically what happens with any type of time you go spend in the hospital, unfortunately, where the family is the most uncomfortable, you're frightened, you're afraid, your loved one is sick, your loved one needs surgery, and they show up at the hospital and you have no idea what in the heck's going on. You feel like you're kind of at a loss. With our orthopedic program, it is a known fact from the beginning. You once it's determined that you're going to need surgery, you go to a class and they tell you exactly what to expect, what you're going to expect from a therapy perspective, what you're going to expect from a surgery, how long you're going to be in the hospital, what you're going to need on the back end once you get home, how long you'll need home health. So from the moment the decision is made to the end, and your family's included in that. So there is a known factor of what the expectation is, and we're really just managing the expectations. We're letting someone know that as opposed to 4 days in the hospital. If you've had your hip done, you may leave that day, or you may be gone in a day and a half. But it truly is a collaborative approach to family, physician, and patient, and that's the difference.
You had mentioned before that folks aren't exercising as much as they used to. Is that?
That is absolutely correct.
Really?
There's been several studies done in the last year that shows between Missouri and Illinois, we are two of the worst states when it comes to obesity and the size of our population. So no, we're not exercising enough.
Yeah, obviously, and I'm surprised by that, though. I would think that people would be picking up more on being healthy because that's constantly brought to your attention, to everybody's attention, that if you do these things, you're going to have a healthier life and
Well, you
not have to
would.
be so concerned about these types of issues.
And it's the more that you move, the better off that your joints are in your back. And there's been, again, studies done that shows if you just really get up and move 30 minutes a day, which means, one less Big Bang episode that you have to watch. But 30 minutes a day really is all you need to become mobile and help improve your heart, your health. And so if you're improving your back, your hips, your knees by moving, you're also improving your heart muscle. You're decreasing the chance of being overweight, decreasing the chance of having some sort of type 2 diabetes. Truly, moving is kind of the big deal.
Is it also a situation, too, where as we keep advancing in medical technology and procedures and that folks do realize I can be treated for this, so it's okay for me to have a crappy lifestyle because I can be taken care of down the road?
I think that's the problem. I think that people assume that if they just they don't have to worry about it because there's a pill. There's this magic pill.
Or there's a surgery or there's something like that.
Magic surgery that can do that. And what they don't understand is that there might be, sure, I might gain 100 pounds and I might need to have my knee replaced, but the physician's going to tell me you've got to lose weight before we can do that, or you've got to quit smoking before we can operate on your spine, or you've got to at least do some exercises before we do some other things. So the best thing is just to begin to move.
It's amazing, too. You mentioned weight. I talk to so many people that say, I lost some weight and I could not believe how much better my back felt or how much better my knee felt or how much lighter I felt just living, walking, running, whatever.
You don't have the pressure on your body. You don't have the pressure on your back. You don't have the pressure on your knees. And it's just, not only that, but it just feels better once you begin to lose weight. I think your mental capacity is a little bit better. You feel good about yourself, buying some new clothes. It all is connected.
Right.
And those that, say, for example, lost 30 pounds of weight over the course of time, they go back and it's like, how much is 30 pounds? And they actually get 30 pounds of weight and carry that around for a day. And it's unbelievable.
Mm-hmm.
It is a chunk.
Yeah.
It's almost like if you put 60 pounds in a book bag and just carried it around on your back all day long. Imagine your back's going to hurt by the end of the day. But it's just all that extra weight that we've all carried around and not moved and not exercised and all this kind of eating bad food and all that kind of wonderful stuff.
Tim, when you talk about hurt, pain management, that's another big thing, too, that you're working on and that you've got solutions for.
It truly is. I think our whole organization is excited about our orthopedic, spine, and pain management capacity. What we've tried to do is capture all the things that would be involved in that. Dr. Lavelle Glanton gets referrals from this entire region from a pain management perspective, whether it's injectables, whether it's implantables. But what he is able to do is come in and he gets a lot of referrals from docs that can't figure out what the pain is. Is it a headache? Is it just a back? But he's able to get you back to work within a certain amount of time and get you back on your feet.
Better than taking a pill.
It really is, and I again, it just comes down to how are we able to deal with the pain. If you're able to live with it, great, but you still should start moving. But at some point in time, it becomes too much. And when it gets to that point, then you should always just go see someone.
Also taking kind of a preemptive measure, if somebody, say, for example, has to have surgery, there's a number of things that patient can do to get them back on their feet sooner than later before the operation.
There are some of our physical therapists would tell our total knee patients, if you have a chair at home that has two arms on it, and this is simple, if you're a Medicare patient or you can just begin to push down on the arms of the chair and just begin to kind of lift yourself up off the seat because it begins to build your arm strength. That seems like something kind of minor, but you're going to have someone that may be 70 and not have exercised a lot that is going to have to use a walker for a couple of days or for a week to kind of move themselves around, get themselves out of bed. And if they don't have that arm strength, they're not going to be able to do it. So there really is a lot of different things that come into play. And they wouldn't know that unless there is truly a program perspective from the front to the end on how you really should have it kind of manage what you're going to go through. And that's what we're excited about.
And you're making it shorter all the time.
We are. I mean, years ago, if you were having, we go through these exercises every now and then to determine, back in the Stone Ages, how long you might be in the hospital for something. I think total hips were like 8 or 9 days or something, and now we're down to about a day.
Mm-hmm.
It's good. It's going
amazing.
to be outpatient. Well, it's just like a factory. I shouldn't say that, but the car comes through and certain things occur every time.
Yeah.
The engine goes in, the doors go on, the seats go in. When it comes to surgery, a lot of times, incisions made, the implant is sized, and things are done. So it's just you do the same thing all the time. You want to reduce the variation of how something's done.
Sure. All right. The proactive approach of healthcare. Tim, thanks for sharing, and congratulations on those awards. And
Oh, no. Thank you.
we'll keep moving forward.
We're having fun over there.
All right. Well,
Thank you.
Yeah, it shouldn't be a job. It should be an adventure. Speaking of which, you've got that trail that's now the ground's been broken around the hospital, and soon we're going to be enjoying that nature trail.
Yeah, I don't know if you've been to our campus, but our campus is gorgeous. It's not just brick and mortar, but now we have this trail that we're going to build, and we brought ground on it. The foundation was instrumental in getting that done. Team members are out walking, because now they're out walking on the streets, and we don't want street walkers, so you kind of want them on the trail where it's safe. So we're excited about that.
All right. Tim Polly is Executive Director of the Hannibal Regional Medical Group, and he's our guest on Healthy Dose. You can get more information online, by the way, hrhonline.org. Hannibal Regional Medical Group and Hannibal Regional Hospital bring you your weekly capsule of health information each and every week, your Healthy Dose.